I'm Dr. Virginia Caine, Director and Chief Medical Officer for the Marion County Health Department, and I'm going to be the moderator for this exciting program this evening, looking at the dangers of lead in homes and water during the outbreak of the COVID-19. I think all of us have seen across this country the impact of the COVID-19 pandemic and the challenges that a lot of houses are facing with our cultural climate, especially as it impacts some of our vulnerable populations that may be exposed to environmental hazards, such as in homes through old and worn out water pipes or through the dust that's in their homes. And we can look at situations like what's happening with Texas that highlights how important it is for us to be prepared related to the dangers of lead. And so I'm going to ask everyone to just give. We're excited about having 3 federal agencies on this call. Government Accountability Office, the U.S. Department of Housing and Urban Development, and the U.S. Department of Environmental Protection Agencies. So if I could, I'd like to get an introduction, 1 minute from each panelist. And if I can start with Ms. Beth Faraguna, I believe.
Hi, everyone. My name is Beth Faraguna. I'm an assistant director with the Government Accountability Office. I mainly work on housing issues for GAO. I focus on housing quality, rental assistance to low-income families, as well as homeownership. I've done a number of GAO reviews where we've looked at the management and oversight of HUD programs. And to this end, GAO did a big review looking at HUD's efforts to reduce lead paint hazards in housing. We issued a report in 2018 on that. And I'll speak a little bit more about the findings and recommendations from that 2018 report as part of today's panel. Thank you for having me.
And thank you. And Mr. Gomez, I know that you're actually the director, but I was trying to get ladies first. So if you'd introduce yourself too as well.
Completely understand. Thank you very much. And also thank you for inviting GAO to be part of the NAACP forum. So I'm glad that we could share our work. So my name is Alfredo Gomez, and I am the director in GAO responsible for our environmental protection work, which includes our work looking at water, drinking water, clean water, lead in water. Currently, we have also issues with PFAS chemicals in water. We look at cleanup of hazardous waste sites. We're looking also at issues dealing with environmental justice and climate change. So as you can imagine, all the environmental issues that the Environmental Protection Agency and other agencies are dealing with, we are there and we are looking at them. And in a bit, I'll give a more background about GAO in terms of our role. We work closely with the states and local governments as we look to see how federal programs are implemented and see how well they're working. And then our goal is to make recommendations to improve those services. So thank you.
I'm sorry.
Dr. Caine, you're on mute.
I'm just not right. So we have another outstanding member of your team, another assistant director, Miss Diane, was it Raynes?
Yes, that's right.
Who would like to have you introduce yourself. Thank you.
Thank you so much. I'm delighted to be here. Thanks for including GAO. As Ms. Caine said, I'm Diane Raynes. I'm an assistant director in GAO's Natural Resources and Environment Group. My portfolio covers water, primarily drinking water issues, toxic chemicals, children's health, environmental health, and the associated issues in all of those areas. As Alfredo said, our goal is to try to improve government operations, and we will cover a number of our reports today that have focused in on lead in drinking water and lead in paint. I look forward to the forum today.
Thank you so much. And then I think our next speaker will look at the Office of Lead Hazard Control and Healthy Homes from the U.S. Department of Housing and Urban. And so if I believe Mr. Haber.
Thank you, Dr. Caine. Yes, my name is Bruce Haber. I'm the Director of the Program and Regulatory Support Division within the Office of Lead Hazard Control and Healthy Homes. It's a small division, and our responsibility is to oversee activities under the Lead Safe Housing Rule, which is a HUD rule for assisted properties, as well as working jointly with the US EPA on enforcement and evaluation of the federal lead disclosure rule. Thank you for inviting us today.
Thank you. And then the next person is it Mr. Paul Diegleman?
Yes, ma'am. Thank you, Dr. Caine. My name is Paul Diegleman. I am the Healthy Homes representative for the Office of Lead Hazard Control and Healthy Homes, responsible for Regions 5 and Region 6. I've been working with the state of Indiana since about 2002. First time I came out there, I was working with then Field Office Director John Hall, who's one of my favorite people on the planet. And now we're working closely with Field Office Director Kim Wise in trying to create more business in the state through our grant program, but also through many of our other programs as well. So thank you for inviting us.
And then we'll move on to the next Deputy Assistant Administrator for Land and Emergency Management, Mr. Carlton Waterhouse.
Thank you so much, Dr. Caine. My name is Carlton Waterhouse, and I am the Deputy Assistant Administrator for the Office of Land and Emergency Management, as you've mentioned. And our general responsibilities in our office is to oversee quite a few programs. One is the Superfund program that's engaged in doing removal and long-term remedial actions to clean up sites that have been considered to be national priorities, and to deal with removal and emergency actions for other sites. We also oversee a Brownfields program, or the Brownfields redevelopment program and land revitalization, that provides millions of dollars every year in grants to local governments, to municipalities, to nonprofit organizations, and others to undergo site assessments, site cleanups, as well as to do job training for people who live where brownfields are located and are looking to get skills development work that will enable them to get into the workforce doing cleanup. You're still on mute, Dr. Caine.
Well, I'm just trying to get techie these days. So we're going to move on to our next agency with the Environmental Protection Agency, and if we could have Ms. Cheryl Newton do an introduction.
Thank you, Dr. Caine. I'm Cheryl Newton. I'm the Deputy Regional Administrator and currently Acting Regional Administrator for the Region 5 Office of the Environmental Protection Agency. We implement and oversee all of the agency's programs in the 6-state region, including Illinois, Indiana, Ohio, Minnesota, Wisconsin, and Michigan. And on a personal note, I would indicate, since our office is in Chicago, but I'm actually a Hoosier and coming to you all tonight from Northwest Indiana. So great to be here this evening.
Still on, you're on mute.
Right, sorry. Mr. Watts, if you'd introduce yourself from EPA.
Yes, thank you, Dr. Caine. I appreciate being invited here tonight. I work for Cheryl. I direct the Tribal and Multimedia Programs Office, where we serve 35 tribes and conduct environmental reviews. Especially relevant to my participation tonight as I manage a group of community support programs, including environmental justice and children's health, where we focus on supporting access to EPA programs and collaborative problem solving to support healthy communities.
So thank you. I don't know if there she is, Miss Rosemary from the EPA. You'd introduce yourself.
Thank you so much, Dr. Caine, and thank you for NAACP and others for having me here. Really excited about this conversation today. I'm Rosemary Inobakri. I'm the Associate Administrator for the Office of Public Engagement and Environmental Education with the Environmental Protection Agency. And so my job is to engage stakeholders, engage the community in the work that the agency is doing. Really excited that this new day that the government is in, this new day that EPA is in, where we're actually able to have conversations and engage communities in the work that the agency will be leading around environmental justice, around climate change, around clean water, and so many important issues that we're going to tackle in the months and years ahead. And so I'm really excited to be a part of this panel and have this conversation with each and every one of you.
So let me just thank all of you, especially on behalf of our sponsors, the NAACP, the IUPUI Arts and Humanities Institute, the Hoosier Environmental Council, celebrating 37 years in New America, for putting on this program. And so just delighted. We're now going to show a short video that I think is really important for all of us to take a look at. Thank you.
It is not the quantity of water, but the quality of it that's a problem in Newark, New Jersey. This week, water fountains were shut down in city schools due to lead contamination. As Jerika Duncan reports, evidence suggests officials knew about this problem for years.
A memo from the district sent on August 30th of 2014 mandates all schools run and flush each water fountain for 2 minutes daily before school opens. The same steps applied for cafeteria faucets prior to food prep usage. And principals were instructed to tell students and staff to run fountains for at least 30 seconds before drinking the water. Annual water contamination tests at Newark's public schools were conducted between December and February. On Wednesday, the district turned off water at 30 schools after results revealed unsafe lead levels. Evilise Mency's son attends one of them.
I send my son to school every day to be safe. This is his safe haven, and then lead is in his water.
Lead in drinking water should not exceed 15 parts per billion.
Across the nation, there has been a lot of news coverage on a growing problem in many schools.
This afternoon, a central Indiana school district is on high alert after unsafe levels of lead are discovered in its water.
Test results within the Ithaca City School District that show high amounts of lead in water sources.
Elementary school children exposed to dangerous amounts of lead. High levels found in water at Imperial Beach Charter School's West Campus.
And this comes after other San Diego County schools have already shut off their faucets. Our 10 News reporter Jennifer De La Cruz is here with how the administration is handling this. Jen.
Well, if it weren't for water bottles, students at this school would have no safe water to drink. The results came back positive for lead on Monday, but students may have been drinking contaminated water here all year long.
We drink the water every day at that school, and we don't know how long it's been there. We use it about 3 times a day. Through the whole school year, 3 times a day. When I go up and down the hallways, I see lines to the water fountain.
But the same lead water running through the fountains is also found in the bathroom sink.
I don't like washing my hands, but I have to because either way you'll get sick.
So how does lead get into school drinking water? Many school buildings in the U.S. are old and were built when lead pipes, solder, or fixtures were allowed to be used. When water is in contact with those materials for extended periods of time, over weekends and holidays for example, the toxin can leach into it. Water can also become contaminated if small particles containing lead break off.
Lead is a toxin. It's a poison. It destroys brain cells. You do not want your child's brain cells to be destroyed. No amount is okay for your child.
In speech class, we do some activities with our speech, and that it helped me to to get my sound, the SH sound out of my mouth, not out of my cheeks.
windows, this is new, but they've been replaced. But had they not been replaced, moving the window up and down causes friction, which would bring in the lead paint.
This is irreversible. The child will, as the child grows into adulthood, will indeed suffer cognitive disabilities.
So lead is a problem because it's one of the most potent, or if not the most potent, neurotoxin that can affect children. Kids that are affected by lead can have behavioral problems, be diagnosed with ADHD, oppositional defiant disorder, have difficulty in school, they have lower rates of high school graduation, they have higher rates of aggressive behaviors, they have more interaction with the juvenile justice system.
Jennifer Rivera is a preschool teacher in Flint. She describes her 4-year-olds as low-income, high-risk.
Thank you for my family.
Well, it breaks my heart because they already have a struggle. Everything is a struggle for them already. What do we do with this?
Now she watches closely every day for signs of lead poisoning.
I've noticed the speech, the articulation, and I've noticed behaviors of anger.
Right now, Flint is getting a lot of attention. Right now, these kids are getting a lot of attention. But this is the insidious part about lead exposure. The symptoms may not show in the weeks to come or even the months to come. It could take years. And every single one of these children will have to be tracked their entire childhoods. 15 and
18. Education, good nutrition, a stable upbringing help lessen the effects of lead exposure. But those building blocks of childhood are also exactly what was lacking for so many in Flint before this ever happened.
Do you have faith that the city officials and the state officials are going to be committed to this problem and are going to do what is needed to fix it and to help these kids?
I do not at this time.
That trust is gone, isn't it?
Mm-hmm. Because they knew, in my opinion, and they let it happen.
Thank you. So I'd like to ask our panelists, if they can, starting with, can you explain in 2 to 3 minutes, what is the major role or responsibility of your organization in relationship to protecting the environment? And if I could, I'd like to start with the Government Accountability Office.
Thank you, Dr. Caine. And so I think this is where we show the slides, if we could, because I wanted to explain a little bit about GAO, and then my colleagues are going to explain a little bit about the work that we do. Next slide, please. So just want to talk about GAO's role, and then as I mentioned, we'll talk about some reports that we've done looking at lead in drinking water, and then also lead paint in housing. Next slide, please. So the Government Accountability, if you don't know, we're a congressional agency. So we work for Congress, and our job is to essentially oversee federal programs. So look at how programs are working. We are nonpartisan, we're data-driven, we're objective. We make recommendations to agency to improve programs, and we also tell Congress sometimes if they need to take action as well. And so we've been working on a number of reports looking at lead in drinking water, and then one big report that Beth mentioned looking at lead paint. Next slide, please. So lead in drinking water, as you'll hear from Diane, there's different roles here. So we've looked at the federal government's role. We've looked at lead in schools drinking water. We've looked at lead service lines. And so we've looked at a variety of issues that are really important. And also, and maybe I forgot to mention, but we work for Congress, and so Congress requests studies for us, right? So different committees in Congress, different ranking members will ask GAO to do work in a variety of areas. As also in the lead paint in housing, we were looking at the federal role. You'll hear about the grant programs that HUD has, and then also the inspections that HUD does. And our goal is usually to make recommendations, right? Because we're focusing on looking at these programs, how well are they working, how well are they achieving their mission, whether there are deficiencies. And so we will make recommendations and have made many recommendations to EPA and to HUD in these areas. Next slide, please. So this is just a slide showing you some of the reports that we have issued recently. And as I mentioned, one of those reports was looking at lead in school drinking water. As you saw from the video, there were many schools across the country that were finding out that they had lead in their drinking water. And so Diane is going to talk a little bit about that report because we had a lot of findings there. But that was a report, again, where we were working with school districts. So we went out and did a big survey, talked to school districts about this issue, and then also talked to states about what they were doing and different regulations that they have in place. We've also done a report looking at childcare facilities and what we know about lead in their drinking water as well. You've heard again that lead is a neurotoxin and is particularly bad for infants and children. And then we've also done work looking at, sorry about that, also looking at available data that are out there that we believe can improve how EPA can identify neighborhoods that are at high risk from lead. Okay, next slide, please. And so I just want to go over really a few key background issues that I think are really important to understand the issue. And so you saw from the video as well that there is no safe level of lead, right, for consumption. And so that's the important thing to remember. Also, you got a sense from the video that who has responsibility for lead in drinking water? Well, it's really a shared responsibility, right? Obviously, EPA, the US EPA, is responsible for setting those national standards. They oversee how states are implementing these regulations. EPA takes enforcement actions, states take enforcement actions as well. And then you have the local government, right? The water utility. So really it is a shared responsibility at the federal level, the state level, and the local level. The water utility has the primary responsibility to ensure that our drinking water is free of lead. So just sort of keep that in mind, that it's lots of players, right, that are involved here to ensure that the water you and I are drinking is safe. And then also very recently, EPA updated the national standards for reducing lead in drinking water through what's called the lead and copper rule. And hopefully EPA can talk about that as well. And in terms of HUD, HUD issues the lead paint regulations for federally assisted housing, and they administer a grant program. And I think we'll hear a lot about the grant program as well. Next slide. So I wanted to cover just a couple of things about lead. So where do we find lead, right? So lead, as you heard, can be found in pipes, in what we call lead service lines. And so what this picture shows you, you see the main water line coming on the street, right? And then you see the service line going from the main to the property line. That line is the responsibility of the water utility. If that line has lead in it, there are programs and efforts now to replace that lead service line. But what happens from the property line into the house, that lead service line is the responsibility of the homeowner. So if you are concerned about lead in your home, you not only have to worry about the lead service lines coming to your property, but you have to worry about the service line in your own property. In addition, you have to, know whether your pipes in your house, your fixtures, whether you have lead solder. So those are all the things where you have to be concerned about. And again, this is where local water utilities are working with homeowners to do the testing and to identify those areas that are high risk of lead in drinking water. Next slide. And again, this is just showing you that this is a shared responsibility when it comes to ensuring that our water is free from lead. As I talked about, the EPA has a role, the states have a role, the water systems have a role, And the homeowner has a role because they're also the ones that are taking the samples for the water utilities. And so you might hear something about that as well. Next slide. And I think this is going to Diane now to walk us quickly through some of our reports and some of our findings. So Diane, to you.
Thank you, Alfredo. I'm going to talk about 3 reports we did focused on lead in drinking water. I'll give you a few key findings and talk about some of the related recommendations. This first report that the slide highlights addressed the challenge that many water systems face, which is trying to identify areas at risk of having lead service lines. We found data that can help predict communities with these lines to help focus lead reduction efforts in those communities. So this is a series of maps. We evaluated data from several locations, and this is Cincinnati. And you can see that the 3 maps have highlighted sections all in about the same areas. What we found was that neighborhoods with higher rates of lead service lines also have higher rates of families in poverty and areas with older homes. The map on the left is a map of lead service lines. The map in the middle shows poverty levels, and the map on the right shows housing age. Next slide. Another issue the report looked at was public education. And everyone gets information from their local water system in what's called a consumer confidence report on an annual basis. Many water systems also provide additional information about lead, and this is a couple of examples of that. The flyer on the left is from Massachusetts. The flyer on the right is from Denver. I just wanted to point out a few key facets included here. On the flyer on the left are suggestions for how to reduce lead exposure, doing things like flushing your tap, using only cold water for cooking, and removing and cleaning the aerators in your faucets regularly. The flyer on the right identifies some of the locations where you can find lead, just as Alfredo mentioned previously. Next slide. A related recommendation, a couple of recommendations we had in this report were encouraging EPA to develop guidance for water systems on how to identify the locations of sites at high risk of having lead service lines. And the guidance hadn't been updated since 1991, and we think using the kind of data that we discussed could really help. Next slide, please. Another report we worked on focused on lead testing in schools. We reviewed the extent to which school districts were testing for, finding, and cleaning up lead. And this is a picture of the locations where you can commonly find lead in a school, faucets in laboratories, in bathrooms, in kitchens, such things as ice machines and coffee makers too. Next slide, please. Here's some of the data that resulted from our national survey of school districts. We found an estimated 43% of school districts tested for lead, but 41% did not. And of those that tested, an estimated 37% found elevated levels. Next slide, please. This map shows by district area the amount of testing taking place in different regions of the country. And you can see in the Midwest region, where Indiana is located, about 40% of school districts tested for lead, and about 30% found elevated levels. There's a range, as you can see, and you might note that in the Northeast, about 86% of school districts tested for lead, while only about 20% tested in the South. Next slide, please. And here we show some more data from the survey we did. This is showing the kind of steps schools were taking to reduce or eliminate lead. For example, an estimated 71% said they replaced water fountains, 63% took water fountains out of service without replacing them, and 62% flushed the school's water system. And many schools did multiple efforts such as these. Next slide, please. And here we focus on our recommendations. We encouraged EPA to update its guidance to schools, and they did just that. In fact, you can go to EPA's website now and pull up a document called the 3 T's, training, testing, and taking action. And there's a toolkit and some written material to help guide schools if they are ready to undertake a testing program. Next slide, please. Another report we did focused on public childcare centers. And in this case, we used a similar methodology to what we did for schools. And what we found was by doing a survey of over 700 Head Start centers, an estimated 43% of them did not test for lead, but 26% did. So not very many. Next slide, please. Fortunately, only about 10% found lead. Next slide, please. And here we recommended that the agency responsible for this program create a plan to test drinking water in all Head Start centers nationwide, and they do plan to do so. I did want to make a note that we know Indiana is providing funding for testing in schools and childcare centers, and there is an opportunity now to apply for that funding. I think the deadline is in mid-March, and I think you can go to the indiana.gov website to find that specific information. Before we turn to paint and let Beth provide some overview, we wanted to show you a brief animation that illustrates how lead gets into drinking water. Ariana, can you show that for us?
When you hear news about lead in drinking water, you may wonder how that happens and whether you're at risk. Is there anything you can do to reduce your risk? Let's answer some of those questions. Here's a look at a water system. Water can come from an underground source like an aquifer or an above-ground source like a river or reservoir. It's piped from the source to a water treatment facility. The water is treated and sent out via water mains and service lines. These pipes could possibly be made of lead. Water with certain chemical properties, such as acidity, can cause pipes to break down or corrode. Corrosion can happen to pipes, solders or joints, or fixtures. If they're made of lead or brass, they can leach lead into the water that ends up in homes or buildings. Public health agencies have determined that no level of lead is safe for consumption. The Environmental Protection Agency works with states, water systems, and others to ensure that water is routinely tested for lead and treated when necessary. So what can you do about lead in your drinking water? EPA suggests a few steps. If you want to determine the quality of your water, one option is to contact your local water utility for a copy of their latest annual report. Or you can have your home's drinking water tested for lead by a certified lab, which may require a fee. Next, there are also some simple things you can do to minimize lead in drinking water. Let your water run before using it for drinking or cooking. Only use water from the cold tap. Use water filters or similar treatment devices. Consider replacing pipes, solders, and plumbing fixtures that contain lead. For more on lead in drinking water and the federal government's role in preventing it, click the attached link to view our report and visit us at gao.gov.
Thank you. And I'm going to turn it to Beth now, who can talk about our work related to lead and paint.
Sure. Hi, everyone. And so in the video that we all watched, we saw a lot about lead in drinking water. There was one little clip about lead paint in housing. And Ariana, if we could go to the next slide, please. But I do just want to mention that lead paint hazards in housing is the most common source of lead exposure for children. And so the hazards can be found in dust as well as paint chips, as you'll see on the slide there. The video got a little bit into this, but the reason why children are at increased exposure, one is because of their behaviors. They often crawl on the floor or they put non-food items like paint chips into their mouths. But more importantly, it's because of what they noted in the video, that children's brain and nervous system is still developing, and the lead has a greater impact on their health. And so next slide. And so just to remind folks, the US banned lead-containing paint used in housing in 1978. And so generally speaking, houses that were built before 1978 are at risk for lead paint hazards, and post-78 are not. The further back in time you go, there's greater risk for lead paint. And what I mean by that is houses in the US that were built in the 1940s and 50s, they're much more likely to contain lead paint than houses that were built in the 1970s. The reason why is that the paint manufacturers were already starting to phase lead out of the paint as you move towards the 1970s. And this slide is just showing a couple of examples of exterior lead paint that's chipping and peeling. Next slide. And then we have a couple of examples here of interior lead paint. And so again, the lead was used in both exterior and interior paint. So the hazards can be inside of people's homes as well. Again, the slide just showing some chipped and peeling deteriorated lead paint. Next slide. And so the only way to really know whether or not the paint in a home contains lead is to have a lead evaluation. And so in Indiana, there are certified professionals that can come out to people's homes or apartments and test the paint. This slide is just showing some of the tools that these lead professionals use when they do come out to conduct a lead evaluation. And we could go to the next slide. And so as we mentioned before, in 2018, GAO issued a report on lead paint in housing. One of our key findings from that report was that HUD needed to strengthen their processes for identifying high-risk areas in the US for lead paint hazards. And so what GAO did was we did a national level analysis using county level data. And so what you're looking at here is a screenshot from an interactive map that you can find on our website. And so on the interactive map, you can actually click and zoom in on Indiana and on all the counties within Indiana. And for those viewers in other states, you can do this for any state actually. So it is an interactive map though, and all of the data is available as well. You can download the data that GAO used, because I mentioned we use county level data. And what we did was we looked at two main factors that impact lead hazard risk. So the first is the age of the housing stock, and the second is the poverty level in the county. And then we identified whether or not the counties were at higher risk or not. On the screen that you're looking at, the blue dots are the HUD Lead Grants that are going out to state and local communities. And so you'll see a lot of HUD's grants are going to New England as well as the Rust Belt states. Indiana at the time did have one HUD Lead Grant going to the state government. And we could go to the next slide. And so here, this is just a static version of that same map. I wanted to just provide a little bit more information about Indiana. And again, you can zoom in if you go to the interactive map yourself. And so in Indiana, there were a couple of counties that hit both of the indicators, so having both old housing and high poverty. And that is dark blue on this map that you're looking at. There are more counties in Indiana that have old housing. And so that is the light blue shade. The gray on this map is poverty only. And so in Indiana, there are a couple of counties with poverty only. And then also there are some counties in Indiana that did not have either of these indicators, and that's white on this map. So if you can see a couple of the counties. So that means that it doesn't mean that there's no lead paint risk in those counties, but it means that it would be less likely. And so, and again, this is available on our website and all of the data is there. I think it can be used as a resource for folks in Indiana, both the state government as well as counties. And as I said, at the time, Indiana was getting one grant from HUD. I think that they actually have even a few more grants at this time. We did make a recommendation in that report for HUD to do something similar to this, and HUD has done that since then. And next slide. So I just wanted to mention also that our report on lead paint, we did have 6 other recommendations to HUD. These are all still in progress. These were focused more along the lines of HUD's oversight of public housing agencies and their compliance with lead paint regulations, as well as performance assessment and reporting. And I think that covers it for the lead paint stuff from GAO. I think HUD is going to speak to us a little bit about their grant program.
So yes, so we will thank you so much for that presentation and how to support Congress in improving the performance for the American people. And we just learned a lot about your agency. So I'd like to move forward now to hear HUD's presentation and telling us a little bit about their agency and what resources they may have available for the average resident and community-based organizations that are out here.
Well, thank you, Dr. Caine. This is Bruce Haber again, and we actually are going to give you a little presentation on the Office of Lead Hazard Control in Healthy Homes. And we can also talk to the funding that's available, but we're kind of saving that for a little bit later in the evening in the program today. So
okay.
If you really want to go through it now, I can continue.
No, we'll wait until the end. I'll just let you tell us a little bit about your agency.
Could run out of time. But anyways, so we put together a little slideshow talking about our office. So like, what is the Office of Lead Hazard Control? So, well, we're an office within the Department of Housing and Urban Development, and our intention is to protect families and children from health and safety hazards in housing. It's not just lead-based paint, but there's a lot of hazards in housing that can be there that affects the development of children and the health of our families. So this office was established in 1991, originally named the Office of Lead-Based Paint Poisoning and Prevention. So there are 5 divisions, which aren't that important to today's little discussion, but you should see them. We have our grants and our development and policy and standards, who does a lot of technical assistance work. So HUD's mission is to create strong, sustainable, inclusive communities and quality, affordable homes for all. So this is directly from HUD. And within the mission, there are strategic goals to advance economic opportunity, to protect taxpayer funds, and to streamline our operations to make them more efficient. So we continue to invest in low and moderate income communities, which oftentimes are the same communities that are affected by other environmental hazards in the neighborhood. So we work very heavily for that as an agency. And then where does the Office of Lead Hazard Control fit in? So for advancing economic opportunity, we, as a major effort of the office, work to remove lead-based paint hazards as well as other health risks from homes. So we have our lead hazard reduction grant programs. We have different healthy homes programs that go along with them. And sometimes we have standalone programs for healthy homes. We also protect taxpayer funds through the financial controls, monitoring the monies and the grants that are put out. And we have been able to streamline the application process to make it simpler for government agencies across the country to apply for these funds and therefore be able to use them in their field. So our main objective in the agency priority goals, one of the agency priority goals, is to protect families from lead-based paint and other health hazards. And the goal for the office, working with other programs within HUD, is to create an additional 17,800 at-risk housing units, getting them to a point of being lead safe and also to have healthy homes issues corrected in them. And so for the streamlining of operations, Beth from GAO mentioned it, the mapping, determining what areas of the country have the greatest need because of the age of housing, because the prevalence of environmental hazards, income, lower income housing tends to be in a little bit poorer quality. And then also we try to look and map out where we actually know that there are lead exposed children. So our mission within the office itself is to help children and other vulnerable populations in low-income households reach their full potential by making their homes safe and healthy. And the vision, of course, is to lead the nation to a future where both affordable, where housing is both affordable and designed, constructed, and here's really one of the big parts that's very important, rehabilitated, and maintained in a manner that supports the health and safety of the occupants. So we are building and continuing to build a national framework. We're doing healthy housing research and supporting that with universities and others. We're mainstreaming the healthy homes approach so it becomes part of the regular maintenance and care of housing. We're pushing that and supporting that within HUD, and also using our network of stakeholders across the country to try to get that into the rest of the communities that are not assisted by HUD. And then also we're trying to enable communities to create and sustain the healthy homes. So it's an ongoing, continuous process. So one of the questions, and we're talking lead today, but what is an unhealthy home? The standard hazards, we're talking about lead, but there's also things like pests, cockroaches, and bed bugs, carbon monoxide, mold and moisture conditions from flooding or leaking pipes or leaking roofs, radiation such as radon and asbestos in our houses. And then sometimes you have, housing conditions such as, poor security and other stuff. And these have health effects, such as, and we were talking earlier today, GAO was talking about the effects of lead exposure, particularly on children with reduced IQ and behavioral problems, learning disabilities. But some of these other health conditions cause asthma or aggravate asthma. Cockroaches are a strong trigger for asthma. Radiation, radon, is the second leading cause of lung cancer. EPA estimated it's like 21,000 cases a year. So these are all conditions that cost the individual, and they're also a cost to society. And we have some ideas listed here, such as school absenteeism, academic failure, criminal records and problems with that, and then the cost to society, the healthcare, the extra hospitalization, special education, and juvenile and criminal justice. So these are some of the issues that we deal with as an office, and we work nationally to try to address them. So basically, what is our office doing now? We are providing grants to produce lead-safe units and healthy housing units. We provide money for technical studies, such as research grants, and we provide and monitor the funding to grantees to figure out better ways and methods, cost-effective, to improve health benefits. We also do the enforcement of the lead-based paint disclosure rule jointly with the US EPA, and with the HUD program offices on compliance with the lead-safe housing rule. That's a major effort of what myself and Paul Diegleman, who is on the call today, work on. And then we also develop and promote healthy homes guidance and performance criteria. We have a lot of information that's been developed for responding to disasters and floods. We've worked with EPA and CDC and others to put together a lot of outreach materials that are designed to go to homeowners, to tenants, stakeholders, assisted and unassisted, in order to make the housing, so people can make their housing lead safe and also healthy to live in. So that is the end of what I had for here. And if you wanted to go on, and I would like to actually hold that off for a few minutes, we could talk about the grant funding, but we did have an idea here.
Bruce, we'll hold off about the grant funding just a little bit later in the program.
Okay, Dr. Caine, thank you.
Thank you very much. Now, if we could have the Environmental Protection Agency give us a little idea about their organization and major responsibility features that they utilize to protect our environment.
Absolutely. And I know we're running a little bit behind on time, so I'll be somewhat brief and also allow some of my other colleagues to join in and provide input here. But, EPA's mission is essentially focused on protecting public health and the environment. Over the last few years, we have gotten away from that. We've gotten away from grounding the work that we as an agency do in science. And so I'm really excited to say that science is back at the agency, and that we want to make sure that everything that we do from an agency perspective is grounded in science, and not just for science sake, but in order to protect human health. And so a lot of the work that we're doing right now is really focused on climate change, ensuring that we're leaning in on environmental justice. Drinking water is an extremely important tool for us to be able to look at it, examine, and figure out how to make it better. One of the big things that I'm here to talk about is stakeholder engagement. I think both GAO and HUD kind of gave you some broad strokes on lead and talked really in-depthly about it. But I want to talk about the engagement piece here because I think it's really important that we lift up the need to hear from communities. Because folks are on the ground dealing with these issues every day, and it's easy to sit in DC and make a decision for other people, but we want to work alongside of people in order to be able to address legacy pollution that's been happening in communities across the country. And so stakeholder engagement is really important and really critical for us at the Environmental Protection Agency. We don't have an EPA administrator right now, but hopefully we will have one soon. And Michael Regan had his hearing a few weeks ago and talked about the importance of stakeholder engagement and hearing from the community and working with the community all across the board, urban communities, environmental justice communities, rural communities. We want to talk to everybody because we want to know what is affecting your community and how can we work together to address some of these really important key issues in order to make sure that we are actually protecting public health. So getting the agency back to its core mission has been a thrill for me. I started, a month ago? I think Carlton and I started a month ago, and I think we're just excited about the work that's ahead because what a time we're in. We have a president who has centered equity and justice at the core of his platform. And so we're just really excited to do this work and again, hear from the community and really lean in and work together on addressing legacy pollution that has been affecting communities for quite some time now. So thank you so much. I'm really excited to dig into this conversation.
Thank you so much for all of the remarks about your agencies and some of the activities that you are doing now. So let me just say that on January the 20th, 2021, our President Joe Biden's executive order on protecting public health and the environment and restoring science to tackle the climate crisis. So on screen, it says the White House tells us that it formalizes President Biden's commitment to make environmental justice a part of the mission of every agency, and that this executive order will direct federal agencies to develop programs, policies, and activities to address the disproportionate health, environmental, economic, and climate impacts on disadvantaged communities. So now, in response to this executive order just recently signed by President Biden, I'd like to know, and I'm going to have you answer separately, how does your organization, HUD, and EPA, you're going to answer separately from me, plan to address the disproportionate environmental impact on disadvantaged communities? And give us a little idea about what your timeline is for this. So if you don't mind, I can start with HUD first. Rosemary, since you were, on a good run. So tell me, how are you going to address the disproportionate community?
Okay, from HUD, I will say that the department is reviewing all of our policies and programs and is committed to using evidence-based policymaking to implement the solutions that will work to support with our mission of providing assistance and to low and moderate and families, which are often the ones that are impacted by disproportionately affected by environmental hazards. And I must say that also for our office, the Office of Lead Hazard Control, we have been since its start in 1993 an environmental justice program. The programs were designed by Congress in drafting and enacting the Residential Lead-Based Paint Hazard Reduction Act of 1992, which is also known as Title 10, to address the indoor environment of children and families living at home, and that because they were built before 1978, they might have lead-based paint, and that they're known to be occupied by families that were then, and just as now, more disproportionately poor and minority. So in addition, though, the Act addressed ambient environmental lead conditions, specifically outside of HUD-assisted housing, housing that is occupied disproportionately by poor and minority families by including soil lead evaluations and control of soil lead hazards found by those evaluations as part of the department's requirements for assistance in pre-1978 housing. So that's all part of the Office of Lead Hazard Control. In addition, environmental reviews are done. So any kind of new construction or before a property is brought into a portfolio to be assisted by HUD, they are reviewed for the environmental regulations, and the rules that are in effect now require the properties to be free of hazardous materials, contamination, or other toxics that could affect the health and safety of the occupants. So we are working toward that. We will continue to work toward that. And as the new administration and the secretary-elect, as she becomes the new secretary for the department, I'm sure she will continue this effort going forward.
So thank you very much. So if we could now, if we could have EPA answer the same question specifically.
Thank you. So for EPA, I think the biggest thing that we are excited about is the full government approach to addressing environmental justice. I think that was something that we were excited about and applauded, and I think broadly the environmental justice community also applauded that. The full government approach is going to be necessary for this work. EPA has done environmental justice work for quite some time, but having our sister agencies join in with us to do this work, I think is going to be critical. But based off of the executive orders, there are a few things that EPA we've leaned in on. One is the executive order leaned in on the Justice 40 initiative to deliver 40% of relevant federal investments to disadvantaged communities. And so we're currently evaluating what that means and what that looks like from an environmental protection agency perspective. The next thing is creating an environmental justice scorecard and making sure that we are providing tracking our progress towards achieving environmental justice. And then another big thing that the agency is going to be focused on is EJ Screen and utilizing EJ Screen to develop an environmental justice mapping tool that tracks various pollutants that are happening in communities across the country as well. So those are some of the key things that the agency is focused on from the executive orders that were released by President Biden. A couple of things that we're doing currently to really lean into this process is we're holding stakeholder engagement meetings. Our Office of Environmental Justice and is going to be holding monthly meetings with the environmental justice community to give feedback on the things that we should be doing. So really weighing in with the community and with stakeholders is really important. We had a call just last week with over 600 participants. So the enthusiasm is there. People are ready to get to work, and so we're excited to work alongside of them. And then once EPA's administrator comes on board, hopefully soon, Secretary Regan will come on board and be Administrator Regan, hopefully. He has made a commitment, again, to go to all of these communities across the country, to visit these communities and see in real time, see for himself the things that folks are facing so that we can actively come back to DC and address those issues in a very real way.
So thank you. So now Mr. Gomez, how do you, in your respective position, monitor these two organizations regarding Biden's executive order?
Sure. Thank you, Dr. Caine, for the question. So generally, the way it would happen is the executive order, as we all know, is fairly new, and agencies are going to be taking action. So we would be asked by congressional committees, for example, to look and see what agencies are doing to carry out the executive order. And we've done this kind of work in the past. We've looked at when executive orders have been put in place, for example, by President Obama, where the agencies were required to put together, for example, climate adaptation plans. We looked at a bunch of agencies. We looked at what they were doing, how they were doing it, what their challenges were. So that's how we would be involved, is we would get a request for us to look at, how well EPA, HUD, but other agencies, right, are carrying out that executive order that involves environmental justice. Now, we did, for people here listening, we did do a report looking at the environmental justice working group during the previous administration. And so we did report out on all of these different agencies that are involved in the working group. EPA is the leader of the working group. And we made 24 recommendations to the agencies to really improve their efforts and their working together and the reports that they do, and really how they each are measuring the progress that they're making. So we may be asked to come back and take another look.
So Mr. Gomez, was this the published report in 2018 called the Lead in Housing Report?
So the report that we did looking at environmental justice actually is called Environmental Justice. You can just Google GAO and environmental justice and that report comes out. But it was looking at this working group and looking at how that working group was working, meeting, how they were working with each other, what could be improved. We can actually in the chat include the report number for people to look up.
Mm-hmm. So could you remember any of the recommendations, maybe one or two out of your report that might, just for the public to have a understanding at all?
Absolutely. So one of a number of recommendations that we made were in this area of accountability. So agencies were supposed to do annual reports about what they were doing, and some hadn't done annual reports. So really no one knew what are they doing in this area of environmental justice in their own areas. Some agencies stopped coming to meetings. And so the question was, well, why is that the case? Do they need to recommit? There was a memorandum of understanding among all of them. So it was recommendations around those areas. We also recommended that the working group should really look at their different groups that they had to make sure that they were still consistent with the executive order. But see, what happens now is there is a new executive order, right? So that's probably going to overtake the old one. So really the focus now will be on this new executive order and then how agencies are going to carry that out. So that's I think what the focus will be moving forward.
So then let's kind of move on over a little bit to HUD. And thank you for your comments, Mr. Gomez. But so HUD had a chance to see some of these recommendations, I believe, Mr. Haber. And so as a result, there's always concerns that sometimes people, when they do self-certifying compliance, relying on public housing agencies, can we believe them? Do they do a good job? And so just very curious about that, especially because we had the challenges of trying to identify children with elevated blood levels. And just wanted to know, have you had a chance yet to make any new adjustments or recommendations for this recent report that's come out?
Thank you, Dr. Caine. We did, and we've addressed 3 of them through the Office of Lead Hazard Control. The others were addressed at public housing specifically. And we've been working with public housing to try to improve the monitoring. We've done an awful lot of outreach and education and technical assistance to housing authorities. And sadly, one problem this has been we can't get out to visit housing authorities. So a lot of the work that housing authorities did, and remember, for housing authorities, they've been dealing with lead-based paint regulatory-wise required to do work since the late 80s. And many of them went through and they abated all the lead-based paint in their properties back in the 90s. And of course, they thought they were done. And so they put the files away and they weren't able to retrieve them when we've asked for them more recently. And so some housing authorities have had to go back and do retesting. Now, one of the things of the abatement that was done back in the 90s was a lot of the paint on walls and ceilings for those older properties that had lead paint there, it was encapsulated, which is a permanent solution, and it has a life expectancy of 20 years. And the paint manufacturers who made the encapsulant had to certify that it would last 30 years or 20 years. Now, the problem is if it were encapsulated in the mid-90s, well, it's past 20 years. And so housing authorities who thought they were completed and done are finding out that they really need to go back. And they're learning that lead-based paint is an ongoing, continuous requirement to maintain and operate. And one of the great advances that have happened since 2010 is the EPA Renovation, Repair, and Painting Rule. So more and more workers are getting trained in doing lead-safe work practices, and it's becoming part of the normal workload that housing authorities and other assisted housing and even unassisted housing deal with because they have older properties. But we are working with public housing. We actually have a meeting coming up with GAO to go over what has changed, what's been updated, and that meeting is next week. So I don't want to try to address anything here that the department will be discussing with GAO next week.
Well, thank you. Thank you very much related to that. You know, recently in East Chicago, Indiana had a tragedy in which this public housing was built on a former lead smelter site. And I believe that EPA and HUD was aware of the lead hazards in that area. But so tell me, how do we address sometimes the delay in action or delay in response, and what kind of things can we put in place to really be able to work with local cities, trying to find solutions for a situation like East Chicago? And I know some of the tenants said that they weren't moving because they've been there for a while and they didn't feel that they should have to move. So then you have that piece in terms of education. But if they are moved, how do you find another location that's comparable and has that surrounding support or resources related if a site of people are required to be removed? So how does that process work now in this day and age? And I don't know who wants to go first, whether it's HUD or EPA. So if we had a similar situation like that, so what are the logistics that are involved? So in terms of how are you able to interact or interconnect with each other as an agency? And do you do shared decision making, or is it somebody has one responsibility on one side and another person's responsibility on the other side? I'm just, just from a practical standpoint, how might that work in this day and age now?
If I may,
Dr. Case, this is
Cheryl, if you'd like to.
Cheryl, if you could pipe in, we haven't heard from you. Thank you. And I just want to remind people about Cheryl Newton. She's our acting regional administrator of USA EPA Region 5 out of Chicago. Thank you. Ms. Newton.
Thank you. And hopefully I'll build a foundation.
So we look like she's frozen just a little bit, and let's see if we can give her a few minutes. So while we're waiting for Ms. Newton, Bruce, you may want to speak up from a HUD standpoint.
Yeah, it's in East Chicago was a terrible tragedy, and but I would like to say a couple of things about it because things have changed since then. East Chicago, the West Calumet housing property was built in 1972 before there were national standards for conducting environmental reviews of properties that were being constructed. The site was selected by the city, which is normal because HUD provides the funding and then the communities make decisions on where they want to situate housing, what type of housing they want to build. And so there was no environmental review done back then. Today, if a site such as West Calumet was to be proposed, during the environmental review process, there would come up that there's a potential for problems due to proximity to NPL sites or Superfund sites, or that the site itself, based upon old Sanborn fire maps, was part of some industrial complex. And it would require a much greater look at what environmental conditions could impact the property. And that is a problem in a lot of our cities, redeveloping brownfields. And so in this particular case, they didn't really know, but they hadn't accounted for the fill. The buildings were built, they were built on top of the fill, they had fresh topsoil placed around them, they planted grass, and it was built in the early 70s. As I said, in the future, there would be an environmental review. But for existing structures, HUD and EPA have developed a memorandum of understanding, and we're working closely. There's a Superfund group with our Office of Environment and Energy, and then also with EPA and their Superfund group to coordinate information so that any time that a new NPL site comes on or a Superfund site is going through remediation, we work closely to identify federally assisted properties in the vicinity to see if they might be impacted.
So Cheryl, I don't know if you're back yet, Ms. Newton. I think she was definitely having some technical difficulties. But my question next is, do we now have a complete inventory of lead contaminated sites in Indiana? Who keeps track of that? Is that a EPA? Oh, there you are, Ms. Newton. Can we hear you now? The question that got brought up was, do we have a complete inventory now of lead contaminated sites in Indiana? Do we try to keep track of that, and who would be responsible for that?
So from the EPA perspective, we do keep track of sites, and with Indiana's history, it has a wonderful history of both natural beauty, but also a history of manufacturing, and with that comes contamination. And so we in the region, along with our state counterparts, are constantly updating the known universe of sites, whether it's from lead contamination or other contaminants of concern, as new information and data becomes available. And that's true in both our Superfund programs and our RCRA corrective action program. Currently, at least within Superfund, there's 27 sites in Indiana with lead as a contaminant. And I say that with respect to Superfund sites, not necessarily, that they're indicative of a particular location next to a housing development, for example, but just overall in Indiana, there's 27 sites that we have currently on our list that have lead contamination.
Can you give us a feel for, I don't know if 27 is a lot of contamination sites compared to maybe other states like Ohio or Kentucky, or is it a much lower number of sites compared maybe to some of our surrounding sites, because you have your region, I believe 5.
So given the overall manufacturing legacy in the Midwest, we certainly have a large share of contaminated sites, whether, large contaminated sites all the way down to, local, abandoned gas stations, all requiring some level of cleanup. So it's about proportionate to the fact that we're the largest region with an overall industrial legacy.
Okay, thank you. I just appreciate that. Any other comments anyone would like to bring up related to this issue? And can we ensure ourselves now, because I know we do have new standards working with cities where we never build on a contaminated site, but do we believe we have all the safeguards in place to prevent this from happening again? What happened in East Chicago?
I can speak to at least directly to that question. I don't know that I have an answer that's absolutely assured, but But I can say that we've put mechanisms in place to try to improve our level of coordination with HUD moving forward to try to avoid these kinds of problems in the future. One of the things that we're doing is we're focusing on protecting the health of communities living in or near Superfund sites, and we are also giving particular attention to vulnerable communities and populations. And we understand that residents at HUD public housing sites represent one population that may be more vulnerable to risks. And so, as Rosemary has said, we're leaning in the way we're approaching these problems. We're recognizing also that we can improve the quality of coordination that we have between EPA and other fellow agencies like HUD. And we're trying to explore ways to improve on that and to see that that goes to a new level that just provides greater levels of protection to community members. So, for example, EPA and HUD have entered an MOU that calls for closer coordination in future projects towards any of these HUD sites that are proximate to also HUD-related housing. We're also working to improve the MOU with HUD to allow greater feedback from communities themselves to better inform how we operate. The goal is that we want to make sure that we don't have blind spots that we're not seeing as federal agencies that communities do see. We don't want to see gaps, right? We want to see a web that communities have the kind of safety net that we can provide, and we need their feedback to make sure that that happens. We're also committed to reviewing our procedures to align with President Biden's executive order on tackling the climate crisis at home and abroad, and protecting public health and the environment and restoring science to tackle the climate crisis. And that executive order calls for attention to environmental justice as a longstanding issue faced by communities like East Chicago and in East Chicago. And we're looking to see how can we use the executive order, or how can we fulfill what the executive order is calling for in communities like West Calumet and in East Chicago more broadly. So while our first priority as Superfund sites is to ensure that effective measures are taken quickly to protect everyone from exposure to harmful contaminants, we're also looking for ways that we can provide support for the communities that goes beyond merely making sure that we don't have chemical levels that are dangerous and providing a risk. And so to that end, we're trying to use a holistic approach to community protection that fosters an inclusive response action that brings all levels of government together to address community needs. One of the things we saw in East Chicago was that we had multiple government actors working. We had the mayor of East Chicago, we had HUD, we had the EPA, we had IDEM. And that's difficult, right? It's difficult for community members because how many governments are there, right? It's difficult for them to be able to keep track. And we really have a high level of responsibility in the government to make sure that we're doing our best to be coordinated in everything we do and everything we say. And so we're working in East Chicago to continue our community involvement and engagement with residents as we go through our 5-year review process for the federal cleanup at the USS-led Superfund site. And we're welcoming comments, suggestions, and recommendations regarding how we move forward with that site and its operations, and also have received some initial feedback already from community members. And we're looking to summarize their feedback and make it part of the 5-year review. Ultimately, I would just say with regards to that site, lastly, that going forward, we're going to try to foster opportunities for meaningful dialogue with the community of East Chicago and other communities to protect people from the risk of lead exposure, and to look at how we can use this crisis and turn it into an opportunity for helping those communities to transform. So we can go beyond just providing the basic levels of protection, but also provide the kind of support and revitalization and redevelopment that communities so desperately need.
So, Mr. Waterhouse, I'm going to come back to you because I may ask you what happened to all those residents in East Chicago. Were they able to be placed in an alternate site? But I'm really fascinated, Mr. Watts, about what's happening with our Native Americans and the tribal groups, and what kind of protections and what kind of resources we have for them. And I'm hoping that you could give us some information related to that.
I'm happy to, Dr. Caine. Thank you for that question. Yeah, we have a very close working relationship with 35 tribal nations within Region 5. And in particular, relevant to our topic, through our Children's Health Program, we have an interagency agreement with Indian Health Services that provides healthy home services for tribes across the region. So we can make sure we're providing that kind of assistance and support. And then more broadly, we work very closely with tribal leaders and tribal environmental agencies in providing human health and environmental protection with a specific focus for those partners and making sure that we are respecting tribal sovereignty and investing in building the capacity of tribal governments to operate their programs. And so in many ways, we work with them the same way that we do with states when it comes to oversight of drinking water systems and so forth.
Do they seem to welcome your help, or is there any cultural issues that would prevent them identifying more resources from your agency?
Well, there are certainly cultural sensitivities. They do welcome our help. We have a group called the Regional Tribal Caucus who provides leadership representation to Region 5 and for the tribes so that we can make sure we have a really healthy, constructive working relationship to get things done together. And in fact, we provide regular training for our staff so that they have the cultural competency and understanding of the unique factors that go into working with Native American nations. And we've got some training on that coming up for our folks in early March, just to reinforce that cultural competency that's so important to us doing our work well with these partners.
Dr. Caine?
Yes,
Dr.
please.
This is Mr. Gomez. So I wanted to speak on this topic because we actually did a report that we issued 2 years ago on this topic of tribal communities, tribes, and Superfund sites. So like what's known about Superfund sites and tribal communities. And it was a nationwide review. And we had 4 recommendations to the EPA to really improve their data about just whether there was a Native American interest. Native American communities were concerned that while the Superfund site may not be in their boundary, it was just downriver or just outside their reservation, but it would still impact them. So we made recommendations to improve data, to improve how EPA was consulting. EPA has to do tribal consultation with the tribes. And so we had never looked at this issue before, and we were able to identify how many Superfund sites were on or near tribal communities. And then we made some recommendations that EPA has already acted on some to improve its data and to also improve its guidance to the regions on how they consult with the tribes. So that is a very important environmental justice issue as well.
So thank you. Thank you very much. So you know that the American Academy of Pediatrics recommends that state and local governments should take steps to ensure that water fountains in schools do not exceed water lead concentrations of 1 per pod units. So now, does the lead and copper rule help schools and childcare centers achieve that level? Because I saw in our presentation that from I believe GAO that I'm trying to remember who had the presentation that showed that the South maybe had the lowest number of schools being tested for lead. The Midwest maybe was the second next highest, but I was just struck by how many schools in the Northeast Corridor have been tested for lead. So what kind of steps were done to really encourage lead screening in our state and local schools? Who would like to comment? Are there any resources that can help schools and child care centers achieve the levels of lead? I don't know if someone wants to comment about that.
I can, Diane Raynes from GAO, I can just provide a little bit of background. Probably this is best directed to EPA, but we know that the new lead and copper rule does require testing in child care centers and schools. And there is guidance that EPA has put together that's not only a written manual, but also a toolkit that provides a lot of examples of how to go about planning a testing program in schools. And I think EPA is continuing to gather information and best practices and has offered a number of webinars and other efforts, also in coordination with the Department of Education.
So I know here in Indianapolis, our health department did the funding and the lead testing for our school systems here in Indianapolis. Is that a common occurrence, or do the schools have to fork out the money for the testing? We know they have to fork out the money for any repairs, but what about the testing itself?
I think there are grants available from EPA for testing, and I don't have a lot of detail on that, but
so what if I move into the federal funds and grants available to local communities to help reduce lead hazards in housing and protect the environment in general? I think, Mr. Haber, you were going to address that.
Actually, thank you. I was going to turn it over to Paul Diegleman, the Healthy Homes representative for Region 5. And we have a slideshow because this is more specific to Indiana.
Oh, I love that. Thank you so much, Mr. Diegleman. Let us hear about the resources that may be available to us in the state of Indiana.
Thank you, Dr. Caine. As you can see, we have a myriad of grants in our inventory for producing lead safe and healthy home units. And as you can see, our main program now is our lead hazard reduction grant program. These are programs that are aimed to local and state governments. You must be a municipality or county or a state, and this does not go to directly to homeowners. But the grants eventually get to that level. The last 2 years, we've had a high impact neighborhood grant that goes to those with the highest needs. And then we have the Healthy Home Supplemental Funds, which I'll go over a little bit on the other side. But we also have a Healthy Homes Production Grant, which, as Alan from the EPA mentioned, with the EPA, we actually have a Healthy Homes Production for tribal housing in FY19 and FY20. It goes to federally recognized tribes. We have around for about $10 million in that pot. This year was the first that we had a Healthy Homes and Weatherization Cooperative Grant. This is where nonprofits can get into the game. And then this year, in our note for the to be in FY21 will be a older adult home modification program. So basically an aging in place grant for local governments and nonprofits. So Bruce, please, or Ms. Williams. And then we also have a technical studies grant, which has been incredibly successful, mostly aimed at universities. Some nonprofits can handle these research grants, but it's mostly university based. They do technical studies on both healthy homes and lead. They study if things are working or things that could possibly work in the future. We've had some, Purdue's had some in Indiana. University of Notre Dame's had a few. So the Midwest does an incredibly great job in getting these technical studies. And our notice of funding opportunities, which used to be a notice of funding availability, but now we changed the opportunity. They come out once a year. We are currently working on this year's notice, and I'll show you, please, the next one, what will be on that. Currently, when the GAO did their report in 17, we did have one grant, and that was the state. As you can see, the state grant actually ends next week. And we also have two current grantees in the city of Fort Wayne and South Bend. We have been trying for years to get more applicants out of the state. We work closely with the Indianapolis field office, going back, as I mentioned, in the early 2000s with John Hall, and now with Director Kim Wise and her staff. They do a great job in assisting us in getting the word out to as many cities as possible in Indiana to capture some of these funds. Next one, historically, we've had 26 grants awarded in the state for over $51 million. Now that's not a bad number, but if you look at the rest of Region 5, currently Ohio has more grants currently than anybody in the nation at 13, and Michigan right now is tied for second with Texas at 11. So that's just current grants, not historic. So we have a little bit of work to do in Indiana. So next, please. Now coming up, as you can see, there is a lot of money available. 2018, we had a $136 million notice available funding. This year, we have $512 million with a $360 million appropriation and a possible $152 million carryover. Now that carryover is pretty much COVID related. We ran into kind of a buzzsaw when we were initially going to do the NOFA. That was when the COVID came out, and then a lot of health departments put a lot of the resources, as they should have, to the pandemic, and some of them still are working in that area and have not come back to working on the health and housing. So, and we understand that, but Congress has been good and incredible to us lately in funding our program almost 2.5 times since 2018. So this year we have $214 million on the lead-based paint hazard control side. That can fund well over 100 plus grants. And then we have the 97.1 million. A part of that is the highest lead-based paint and pavement need. That is directed by Congress. Which in the NOFA itself, they have appendices that show older housing stock and impoverished areas that would qualify for what was considered the highest lead-based paint abatement needs. We also have $64 million for the 10 communities with the highest impact areas. That is relatively new, and we're still working on that, as is the 90, which would be part of what is the high impact neighborhood grants. And then the Healthy Homes Initiative, which is 97.6 million, those are already part of the lead hazard control grant. To do a Healthy Home Supplemental grant, you have to fund within a unit that's receiving lead hazard control funds. In the past, we had a standalone Healthy Homes demonstration grant, but this grant ties into the current lead hazard control grant. And then we have the $9.1 million on lead technical studies. And this year we have the $30 million for the older homes modification or the aging in place grant, which is also a first for us. So we're still creating that NOFA as we are with currently writing the 2001 for the demonstration grant. And then last, Next slide, please, Bruce. And as I mentioned, the Healthy Home Supplemental Fund, it's all units that receive lead-based paint hazards, but not all units receiving lead-based paint hazard control will receive supplemental funds, but all units receiving supplemental funds must be within the lead-based paint hazards. So, and then I believe is that the last one, Bruce, for this? Quickly, we are in conjunction with the Indianapolis field office. We'll be doing and within the 4 parts of the state, we will be doing marketing programs based upon geographic areas of the state to try to drum up some more support for the grant within Indiana. As you can see, the 3 current grants, there are definitely areas within the state that could use this grant, and we will do what we can to assist them from the start to the closeout. So, Bruce, if there's anything you'd like to add, please do.
I think you did a great job, Paul. Thank you for describing all the grants. And this audience is maybe one of the greatest advocates to help your communities push forward and try to apply for grants. As Paul indicated, this is the most amount of money we've ever had available. It's a great opportunity to take care of it, to take care of a lot of homes. I saw in the chat questions, people asked, what does all this money in the past go to? We make approximately a little over 12,000 units lead safe every year. That's all across the country. Altogether, our goal is to make over 17,000 units a year lead safe. That's not lead-based paint free, because if lead-based paint is intact, is well maintained, it can be lead safe. But we do address under the lead hazard control grants those greatest hazards that are likely to reappear if they're not addressed in a permanent manner. So a great program. Everybody here on this forum can really be a great local advocate to get your local government agencies to try to apply for additional funding. So thank you very much.
Thank you very much. So I'm just wondering, for those super neighborhood grants, do you have to have a certain level of lead poisoning and that data is captured by HUD or provided by CDC or EPA? How do you know that you are in a high impact neighborhood where you'd be eligible for those funds?
Okay, I could address that. Paul could also. When we issue our notice of funding opportunity, as it's called this year, last year it was called a notice of funding availability. In the appendices to the NOFA, there are charts and tables where you can go and zoom in on your community to find those contiguous, I think it's zip codes, or maybe census tracts, contiguous census tracts, where for the high impact neighborhood, we want you to focus on to really make a big difference in the lives of a lot of families. Because the idea was, if you came in with a lot of money into a small area, you could make a really big difference. And so in the NOFA, in the appendices, toward the end of the NOFA, you can find those, and you can look at last year's NOFA, and you can pull those communities now to take a look at it, because they haven't changed last year to this year.
So do we have any opportunities for people in the community or the neighborhoods to undergo some job training so that you're bringing just more than just really trying to work in the community, but you're doing some empowerment of producing jobs there for folks who may need some new skills? And I didn't know. Yes.
Yes. Actually, all of our lead hazard control grants have a component that allows training. So the simplest training is the EPA one-day renovation, repair, and painting rule training, and that will make somebody a certified renovator. And so that training can then be used by plumbers or carpenters or other people who do home repairs to do it lead safe it prepares them to do it lead safe in housing built before 1978. Now, the lead hazard control grants also provide for funding for training in the Led Abatement Standards, which is the EPA or run by the state program. And these for lead abatement workers, which is typically a 3-day class. Lead abatement supervisors, which are the people that are in charge of a work crew. And that the training is usually 4 or 5 days, depending on which state you're in. And then I don't know, but it would make sense. There may also be some funding that would be available for the lead inspector risk assessors. That's more of a professional side. You saw that device that GAO showed a picture of. It's about $21,000 to buy one of the XRF, one of the machines that do the testing. Plus, you need to have a radiation safety program, be certified by the state for all kinds of different reasons. So the construction aspect is much more likely. And of course, our program does have what we call a Section 3 component, where we are looking at finding low-income residents to try to train them. And so there's a lot of opportunities. And again, it's a matter of finding an advocate locally who really wants to push those out and help the community that way.
So, we have one of the most robust African-American newspaper organization called the Indianapolis Recorder that really gets the messages out to our people of color. So do you ever have opportunities where some of these notices get into our papers so that that message can be spread out to our community residents? How might that work?
We do a lot of outreach. I'm not sure how the notice of funding availability, which is published in the Federal Register, and it's available at.
Well, now let me talk about that, because you got to go to grants.gov.
Exactly.
Really complicated stuff to get yourself on. I see Mr. Gomez, you're smiling here, but this is true, that you have to be very sophisticated how to get on that grants.gov to see those different notices. So I want all those folks that are in public engagement to speak up. So how does the average community-based organizations, civic organizations find their way to get some of this information, and as opposed to having to go to federal agencies and look up that federal agency to see funding for them? Is that the responsibility of local health departments? Or so just tell me here, state health departments or what?
First of all, the lead hazard control grants, to be eligible, you have to be a state or local government agency. For the upcoming, it's not out yet, but the home modification, that would be available to local community groups. So it's going to be a little bit different. So it's not necessarily being run by a state or local government agency. That one is probably one that we're going to have to work with the Recorder and other other local groups to try to get the word out. And that will be Paul Diegleman's responsibility to work with you and try to get the word out when that comes out across all of Region 5 and all of Region 6 and half of Pennsylvania, which is the area that he's helping us out to try to keep those communications going.
Thank you.
Dr. Caine, I was smiling and shaking my head because I was agreeing with you, because what we do in our work sometimes is we act like, consumers. We try to figure out, can we figure this out ourselves? Many times we have recommendations to the agencies to really simplify and make things easier for people to find, whether it's on their websites. We were doing a job looking at discretionary grants, for example, that EPA has, and how can people find them? How would you get information? You had to go to many different sources to try to tell the story, right? So we often have recommendations to agency to simplify things so that consumers and others can see things. Diane talked about, we looked at annual reports that water utilities send out to their consumers. We were also looking to see how easy are they to understand? Are they pages and pages? Do they have pictures? How is it that people would get the message, right? And where do you post it, right? Where would you distribute it? Would you put it in libraries? Would just sending it to someone's home, would they get it? So you're right about this. We want to make sure that people get the message and how they can get the message the easiest way.
I'd like to jump in there if I could, Dr. Caine, just
Yes,
to
please, Mr. Waterhouse, yes.
get the message out about the Brownfields grant program, which EPA has, which provides funding for community cleanups and for lead and other contaminants. And the Brownfields grant program is available to governments, but it's also available to tribes and also nonprofit organizations. This Brownfields development program you can learn about by going to www.epa.gov/brownfields. That's all you have to put down. And it includes workforce development grants. And these workforce development grants are a total of millions of dollars every year to train people to do environmental cleanups. Now, in addition to the workforce development grants, we also have grants for assessment to determine whether there is contamination in your community and in your neighborhood, and grants for cleanup to actually see these contaminated sites cleaned up. This is one of the things that I think EPA does really well. It's resulted in over 2,100 sites being cleaned up, $34 billion. And here's what's maybe of real particular importance. It leads to 175,000 jobs having been leveraged. And what I mean is that for every dollar we spend on brownfields cleanup, we get like $10 back that comes out of new work opportunities and income opportunities. So it's an amazing program, and it's a great opportunity for communities like East Chicago and other places that have legacy pollution to be able to see their communities transformed into new places that provide new opportunities, that help us to avoid climate problems, that bring about sustainability and resilience for the people who live there, and help us to achieve environmental justice. And so I think the Brownfields Grant Program is one of the ways we can turn this crisis we have in lead in America, because it is a crisis, and see it as a place for new opportunities.
So do we have any opportunities for people who buy homes, but maybe they've bought one of those homes built before 1970s, and yet they may not, they have just enough money to scrunch to get that home, but they may not have money to do the lead repairs? Where might they get funding to help them do their lead repair? What kind of maintenance costs, or are there any help related to that at all?
Okay. This is Beth from GAO. For HUD's lead grants, there are income qualifications. And so if a person did have enough money to purchase a home, they might not meet those income qualifications. And so they really are held for the most low income folks.
So these are people in apartment rental places. Is that what you're saying? Maybe.
Yeah. So most of the resources are, really dedicated towards low income folks. I don't know if Bruce could speak a little bit more to that. Yeah, I did also want to mention, just in terms of the ease of getting some information, what Bruce was talking about in the NOFAs. If you just go to Google and type in, HUD lead mapping tool, it's going to bring up HUD's online mapping tool. And so that's kind of everybody knows Google, right? So just go to Google, type in HUD lead mapping tool, and it's going to bring you up HUD's online mapping tool. So you can zoom in on Indiana or wherever you are in the country to figure out if you're in a census tract that's at high risk for lead paint hazards.
So thank you. So I'll just say, let me just think how do I say this? How are our standards? And EPA, let me just say this. I know that over time, it seems like significant amount of your funding has been eroded and not quite at the level it has been at the past. So how comfortable do you feel that when we identify these super contamination sites, might we have the resources to be able to maybe move them to another site, get them with the resources they need? How are we looking along those lines from an EPA standpoint?
Would you like to take that, Rosemary?
Yeah, I mean, I'll take it. I think that, we partner, like you said, EPA's budget has definitely been slashed significantly over the years, right? EPA has never been a favorite entity for honestly presidents or Congress. So the fact that we have all eyes on us this go round is very welcomed. However, I think that the full government approach allows us to be able to leverage other resources from other entities within the government to be able to provide these resources to communities. And so it's our job to work with them and to be able to partner to shed light on the various resources across the government to be able to address these issues, which is why I think, the full government approach to be able to address some of these issues in environmental justice is so critical, because EPA can't do it alone. And there's so many other well-resourced agencies out there to be able to assist with dealing with some of these really important issues.
So then the other thing I just want to try to bring up is that, we want to talk about the safe standards for lead. And so, especially in people of color communities, and, someone remarked in an earlier presentation that no lead is safe so no amount of lead is safe in any concentration in a person's body. But are our lead standards tough enough to protect our children? Any comments related to that? Because we use our cutoff at about 5, but other places use cutoffs at about a 10 per part B unit before getting some services. Any comments related to that? Are we going to go to any new standards? Is there any discussion related to that we need to lower the amount of lead levels in order to provide certain resources than we currently have?
I do think that we are currently, I think, one of the folks earlier said that, a lot of the political team just got in the agency, came on board to the agency. And so right now we're gathering a lot of information, but also, providing public comment, hearing from public health officials, hearing from medical professionals to talk about these various levels, hearing from scientists, right? I think it's all important as we look ahead and reevaluate the regulations and rules that we have in place to be able to address these issues.
So I just want to highlight, always remember, we got a significant number of experts who believe in the science and follow the science from the people of color communities as you make and have a review of your grants. So look to reach out to communities that have people of color that have expertise in this area to review your grants, and always, of course, make it easy to get advice and input about what makes a difference in their community. We're near the end of our program, so I would like to say, just for an example, and I want one person from EPA and HUD. So should a resident of a federally assisted housing unit, what should that person do if their child has been found to have an elevated blood level, or if there's lead-based paint or other lead contamination in their home? So any recommendations from either EPA and HUD?
This is Bruce from HUD. I'd like to start off and then
Bruce.
Turn it over to EPA. But since we were asking about a HUD assisted property, the first thing any resident needs to do is maintain contact with their medical provider. The medical provider will provide them with a lot of information, but they also need to reach out to the housing provider, whether it be public housing or it is a multifamily property, and they need to tell the housing provider that their child has been diagnosed with an elevated blood level. because once the housing provider has been informed, they have responsibilities on the Lead Safe Housing Rule to tell HUD, and specifically also to tell the Office of Lead Hazard Control and Healthy Homes, so that repairs and evaluations can be properly monitored to make sure they occur. You mentioned the blood lead level of 5 micrograms per deciliter. Some communities only respond at 10 micrograms per deciliter. Well, that 5 is not a magic number where it's safe. There's no safe level of lead in our bodies. It is the CDC level of concern, but it's based upon the fact that 97.5% of all children who are tested for lead, we don't test all of them, are below that level. And so CDC could lower the level of concern based upon the way the average U.S. childhood blood lead testing results come out. So the procedures are tell your landlord. If they're subsidized, they're supposed to tell us. We're supposed to track them. They have a certain length of time to get an environmental investigation completed. They have a certain amount of time if hazards are found in order to get the hazards corrected. And if it's a housing choice voucher where it's a private landlord and it's being subsidized by the housing authority will monitor the owner to make sure it gets taken care of properly, or give the family a voucher. They'll cancel the HAP contract, the assistance contract, and the family will be able to move to a property that's lead safe for their child. So that's the procedure. Then I also wanted to mention one thing. You asked about funding, particularly for middle income people. And Beth GAO mentioned that the lead hazard control grants are restricted to lower incomes. And that is true. But there is another HUD program that is specifically designed for home buyers. It's called a 203K. It's a rehabilitation loan where you will get the loan. You will have FHA insurance behind it, and you can get money to do the rehabilitation, whether it be a new kitchen, a new roof, or the lead-based paint. So 203K is just another avenue that HUD does offer out there.
Mm-hmm. Yeah, and I will just add from EPA that to back up those healthcare providers and give them whatever additional information they need to effectively respond, EPA's Children's Health Program funds something called Pediatric Environmental Health Specialty Units, or PACUs. The one for Region 5 that serves Indiana is based in Chicago at the University of Illinois Chicago School of Public Health. And they do a lot of outreach to the healthcare community to provide that environmental health expertise. And they do handle a lot of inquiries related to lead. So we're there to back up the healthcare providers on that front.
You're on mute, Dr. Caine.
Sorry. So let's just say we have a Superfund site, because I think someone wanted to know whether Evansville, Indiana, had a lead Superfund site, and I don't know if someone be able to give me that answer. But how do we notify the people in the neighborhoods where we might have a contamination or identify a Superfund site? Do you go and put flyers on different apartment doors or homes in that area? How does that work? How would they know? Or does it get publicized on television, radio, or in those manners?
So, Dr. Caine, this is Cheryl, and I apologize for my technical difficulties, but it seems to work better with my video off. But as long as you can hear me.
Yes, we can hear you very well.
Okay, so let me share. First, there is Evansville, Indiana is not a Superfund site. There is a Superfund site north of Evansville in Jacobsville, and you know, generally our approach, it really is about getting into the communities, and it's really important for us to build relationships with the communities, and every community is different, and that's why it's so important. What worked in one location may not work in another, and so it's really important to learn, you know, what avenues of communication, what newspapers, what radio stations, what languages even. And, you know, I will share that despite my technical difficulties tonight, if there's a positive that our programs are gaining out of this COVID situation, it's actually learning about how technology can help us better engage with communities, because we don't have to be face by face. We can use technology and do conversations at different points in times rather than a single public meeting. You know, we're using technology where it's automatically translating to different languages using headsets. And so being able to understand how to best engage and work with communities is a top priority of our Superfund program as we engage in every single location.
So thank you. So we're near the end of our program, and I'm going to ask each panelist to tell me in just 1 or 2 minutes, what's the major point to this whole process? And we've read some wonderful information here that you would like to leave with the participants who are watching this forum. And folks, don't go away after that, because we have one of our leading environmental specialists, Dr. Indra Franks from the Hoosier Environmental Council. She's going to present the bills that are going on with lead in our state legislators right after we hear from every panelist. So who would like to start? Maybe start from GAO.
Sure, I can start. So I would say one of the takeaways, especially for schools, because we got a lot of calls on our report, is if you want to know whether or not your school has lead in its drinking water, contact your school, right? They are supposed to be reporting to you as a parent whether or not they tested, what the results were, and what treatment they took. Okay, so always take action yourself. And there are lots of resources, as we were mentioning, where people can go to at the local, state, and federal levels as well. Thank you, Dr. Caine.
Thank you.
This is Diane Raynes. I totally endorse what Alfredo said, and I would expand that to say, if you're concerned about the water in your home, call your local water system. They're also a very good source of information. And I was just checking the website, indiana.gov, and there is a lead sampling program in phase 2 that's providing funding to schools and childcare centers. So I encourage folks to check that out.
Thank you. Beth, do you have anything?
The only thing I'd add to what Alfredo and Diane said is just to remind folks that all GAO products are publicly available. And so check out our website, the video that we played today, the interactive map that we showed. We do these things to help inform the public and to help inform, state legislatures and local governments. And so, and while we focus on, our work is federally focused, we do a lot of work looking at state data and county level data, and it's usually included in our reports that are publicly available. So be sure to just continue to use us as a resource, or start, using us as a resource.
I'll go next to HUD.
Oh, well, thank you. Last thing I'd like to get across to everybody is to remind them that we will have a lot of funding out. We will be working with the regional office in Chicago and the field office in Indianapolis to get the message out. But you can be an advocate for your local community to apply for the grants when the funding is announced.
Thank you. Any other, Mr. Diegleman, or?
I'm sorry, Paul's computer decided it was going to do a restart.
Okay, gotcha. So then real quickly, EPA. Final major point you want to get out.
Sure, I would
go ahead.
Oh, go ahead, Alan.
I just wanted to say for my friends in Indiana that the Region 5 Environmental Justice Program is here to serve you and to help remove barriers for community partners to access the agency. So feel free to reach out to us. You can look us up online, or you could email me, waltz.allen@epa.gov, and I will make sure that we are there for you.
Anyone else from EPA? Carlton, I think you were going to.
Yeah, I was just going to say that I wanted to thank NAACP for sponsoring this event. This is a really important issue. And the fact of the matter is that in the past, the governments, federal, local, state, have not done a sufficient job. This is an area we really have to improve on. And it's going to require, as Rosemary said, a total government approach for us to build that safety net to be tight enough to keep all of our children safe. And I'm excited about EPA really leaning in to improve the quality of protection that we offer to children. And I'm looking at the other members of the federal family and confident they're going to do the same.
Thank you. Anyone else from EPA?
This is Rosemary. I just want to reinforce the point that we want to meet people where they are. We want to go into communities. We want to have very authentic conversations. And so if that means partnering with faith communities and churches, if that means going to barbershops and beauty shops, if that means going to local groups like NAACP, National Action Network, others, we want to do that. And so we are creating a space where we're able to work alongside of those groups in order to be able to get to communities. And so, I just think it's a new day and we need to leverage and capitalize on this moment to really make some sufficient change.
And so, anyone else? Cheryl, any final, Ms. Newton, any final words?
Yes, thank you. As a 30-plus year person at EPA, I just want to express how excited the EPA family is about the opportunities that lie ahead that you've heard Rosemary and Carlton describe, because it really is incumbent upon that executive leadership if you want the entire federal family to work together. And I think we're out in the field. We do our best when we're dealing, community by community and building some of those relationships, including with some of the local federal partners. But to take that whole government approach and really lean in to what's possible and to uncover where the barriers are and how to overcome them, the excitement is palpable for what opportunities are coming. So thank you.
And so I think last but not least, I don't know if Mr. Paul was able to get back on for any final comments, or before we get Dr. Franks on for BOs, let me just say, I just think this people do not realize how incredible this is. To get the top people in 3 federal agencies to make a presentation to us in a local community is just unheard of, okay? Unless you're at some major super contamination site. And so we really thank you for taking out your valuable time, and it shows your commitment as public health servants to help improve our communities and do that educational outreach. And I just want to emphasize again, our sponsors, the Greater Indianapolis Branch of the NAACP. Crystal Ratcliffe is the president, but the person, Gary Holland, the NAACP Education Chair, is very responsible for these program initiatives and work very hard in partnership with the Indianapolis Recorder newspaper, helping to do this webinar for us. The Hoosier Environmental Council, which you're going to hear from Dr. Indra Franks immediately, IUPUI Arts and Humanities Institute, and New America for presenting this virtual public forum. And I'd like to introduce now Dr. Indra Franks to talk about our legislative bills at the for the state legislature in Indiana. So Dr. Indra Franks.
Yeah, thank you so much, Dr. Caine, and thank you for the opportunity to be here. This has been a fantastic program, and I'd especially like to congratulate Gary Holland, our organizer this evening, for putting this all together. And thank you to the members of our federal agencies for great presentations. As Dr. Caine said, I'm with the Hoosier Environmental Council. I work on environmental health issues, and we are a not-for-profit organization. One of the things we do is keep an eye on things that are happening at the state level. This evening, we've heard a lot about what's happening at the federal level to help families who might be challenged with lead exposure issues. Here at the state level, there is a role for our legislature as well. This year, there were 2 bills that were introduced at the Indiana State House. HB 1045, which was introduced by Representative Carolyn Jackson, was to require preschools and childcare facilities to test their drinking water. And HB 1087, introduced by Representative Harris, was to ensure lead-free plumbing products in school buildings. And I'm sorry to have to announce that we've reached the point in the legislative session where these bills have not had hearings yet, so they are actually, they're not going to move forward this year. But there is a coalition of organizations and academics around Indiana that work together on whatever, the sort of the next steps are for Indiana's children. Gary Holland and I both serve on that coalition, and we'll be working with our legislators to look for opportunities to kind of fill in the gaps for Hoosier children when it comes to lead exposure through legislation in the 2022 legislative session. If you're interested in working with that lead coalition or in working on future legislation related to lead poisoning in Indiana, please contact the Hoosier Environmental Council, myself, Indra Frank, or Gary Holland with the Indianapolis NAACP. NAACP. Thank you.
So just want to thank everyone again. We look forward to future collaborations with each of the agencies, and just again thank the incredible sponsors, and special call out to Gary Holland as the organizer. We're excited about you guys being excited about your upcoming work, and so we just appreciate each and every one of you, and we look forward to getting this story out. And we know that the Indianapolis Recorder is going to make that happen. And thanks again, Dr. Franks, for all your work that you do, bringing the science to our communities and working hard with our state legislators and all of our partners. We're going to make a difference. New America, IUPUI Arts and Humanities Institute, that does a lot of work in our minority communities and vulnerable populations. It's just a great way of doing the kind of work we all want to see happen. And so, hey, we may call you back next year to get a follow-up to see all the good progress all of us have made. And so I want to thank everyone again, all of our participants who were on the call. Thank you for your input and your questions, and be safe out there, because COVID-19 has a tremendous amount of challenges, and know that you can get free lead testing through our Marion County Public Health Department, and we'll try to identify special resources to help do lead repair out there in the community. So thank you, be safe. We appreciate your attending this forum. Thanks again.